effects of Tay-Sachs disease on daily life? What is Tay-Sachs disease, you might be asking? It's a rare inherited disorder that destroys nerve cells in the brain and spinal cord. There are three types of Tay-Sachs disease. There's infantile, juvenile, and adult. In first one is infantile. It's the most common severe form, and symptoms include skill learning, like not grasping onto the skill, seizures, and a loss of muscle and mental functions. Children with this form don't usually survive past their childhood, sadly. Juvenile is extremely rare. Symptoms appear at any time during childhood between the ages of 2 and 5. Symptoms include behavioral problems, gradual loss of skill, frequent respiratory infections, and seizures. Children with this form don't pass their teenage years. And the last one is adult. This form is the least severe form. Symptoms include clumsiness, weak muscles, and gradual loss of skill, often leading to the need for mobility assistance. And also, as an adult, you're a lot more developed, so you can combat these a little better than someone that is in the infantile stage. More in depth, what, why does this happen? Tay-Sachs disease is caused by mutations in the hexa gene and inheritance from the parents, meaning that both parents are carriers of the gene, but don't actually have it. The hexa gene gives the body instructions to make part of the beta hexosamidase A enzyme, which is needed to break down a substance called GM2 ganglioside. When the enzyme is not functional or made, GM2 builds up in the nerve cells of the brain and spinal cord, causing the symptoms of the disease. Example is Nathan. He's 4 months old. He looks normal, but he's actually developing early Tay-Sachs disease. Usually, when babies are born with Tay-Sachs disease, they appear normal at birth, and symptoms of the disease do not appear until the infants are about 4 to 6 months of age, when they begin to lose previous skills that they learned along the way, such as sitting up, rolling over. So Nathan here, you could say his dad is trying to help him learn how to stand up or sit up, so he can learn that skill that he lost. Back to babies. Babies fall into this infantile group, as we learned in the first slide, making them in the worst form. Symptoms include blindness, deafness, decreased muscle strength, increased startle response, loss of muscle function, seizures, muscular stiffness, and a delay mental and social development, and a decrease in growth. Once a child is diagnosed with Tay-Sachs, the doctors are basically telling the parents that their child is slowly dying. It's a really sad thing, but nothing can help with that. Effects on daily life, as we learned that they are really just having all these symptoms, and they have trouble eating, moving, and breathing, and also the life expectancy is really it's decreased dramatically. So that's sad. Mobility problems is one of the major problems for it. People with it, people with it or children who have it frequently fall. They have trouble getting from point A to point B, and mobility is caused by a combination of muscle weakness. Devices are used, especially motorized wheelchairs and scooters, ramps, and stairway chairs can be used to help combat problems like these. Regular exercise is also strongly recommended for all affected individuals to help them maintain the highest level of mobility possible, so their muscles don't tense up, make them lose mobility. Uh, Therapy is also really useful because it can help keep joints flexible and maintain as much mobility as possible. Physical therapy can also delay joint stiffness and reduce the loss of function and pain that can result in shortened muscles. And also, another problem is eating problems. When muscle movement is limited, children may often not be able to bite on their food, or children may have trouble swallowing or develop respiratory problems by inhaling food or liquid into the lungs without eating and while eating it. To prevent these problems, they use feeding tubes such as feeding tubes, which is inserted through the child's nose and goes to the child's stomach. Also, doctors trained in stomach surgery can also put a tube through the stomach to help eating, but that's often not really the move or the best option. Respiratory problems is one of the bigger problems. Children with Tay-Sachs disease are at a higher risk of lung infections that cause breathing problems and frequent accumulate mucus in their lungs, having to make them not be able to breathe as good. Machinery is used to help break down the muscles in the lungs. Devices include uh, vests that break up the mucus and portable tanks. Children may also use chest therapy to help remove mucus buildup in the lungs. An example is chest psychotherapy and is performed by therapists in order to remove mucus from the breathing passage of a child or patient that has Tay-Sachs. Now back to Nathan. He sadly died on June 19th, 2014 at 4 years old. Uh, he was in the infantile stage, so it was really, really rare for him to get into the next stage or past his childhood, early childhood. And it's really sad to see that he didn't make it. But how can we prevent this? Well, right now there's no cure as a recording of this video, and the best option parents can do is not to have the child at all. They should first go and get tests on them on both parents to see what they're carriers of, not only just Tay-Sachs, for other diseases. So let's say if they're both carriers, the child will most likely have Tay-Sachs disease. So that's the best prevention we have at the moment. Why is this important? Well, they approximately 1 in 30 Ashkenazi Jewish people carry the gene for Tay-Sachs disease. 1 in 300 people for non-Ashkenazi Jewish inheritors is a carrier. In Jewish population, about 1 in 3,600 newborns are affected. Tay-Sachs. The reason people should be aware of Tay-Sachs disease is because it's not just another rare disease. It's a disease that affects really young children, making them unable to develop like other children their age. The children rarely survive after 4 or 5 years, so this matter should not be ignored. September is Tay-Sachs Awareness Month, if you're wondering. And this is my works cited.